Hello, everyone. Thank you so much for helping out. My name is Ransom Onyema. I'm a final year radiography student based in Nigeria. And yeah, apart from my studies in radiography, I'm also a professional medical writer and also a YouTuber. So today I have another amazing guest speaker. Um, she's a medical doctor in the UK, and whenever I invite medical doctors, you should know that in med talks chats. So Dr. Sina, could you introduce yourself to the audience?
Hello, everyone. I'm Dr. Sanaa Anie-Akwetey. I am formerly an A&E doctor, now a GP practicing in London. I'm also a writer and a artist, and it's a pleasure to be here.
Amazing. She's a writer. Wow, amazing, amazing. So the first question for you, Dr. Sina, is what really prompted you to, make that transition from emergency medicine to primary care, and how has this change, affected your approach to patient care? Talk us through.
Great question. So I transitioned pretty much after COVID. So I'd fallen in love with A&E during my foundation years. What happens here, as well as in most other places, I think, is after your 5, 6 years of medical school, you do 2 years foundation years where you rotate in hospital. And during my A&E rotation, I fell in love with it and knew that that was likely what I wanted to do. And so what happened after that was I decided to get more experience in that. I worked as an A&E doctor for 3 years. Then during COVID was frontline, and as I'm sure many people know, that was a challenging time for healthcare and healthcare provision. But it also forced a lot of us to think about our priorities in life. And I realized that actually it was probably time to transition to primary care, where I could have a bit more of a frontline role in the community without it being kind of emergency life and death, but helping people on a day-to-day basis, as well as having more work-life balance for myself. So that was how it
Yeah,
happened.
emergency medicine is it's a very complicated specialty medicine. A lot of impromptu cases.
Yes.
Where I do where I do my clinical rotations at a federal teaching hospital here in the state. Whenever you go to the ER, which is the emergency medicine department, that
Yeah.
place is terrible. It's really terrible. You just get like unexpected calls.
Yes.
Whenever even you're ready, whenever you're ready, you're not ready. You just get
Yeah.
calls.
Yeah.
But that
Yeah.
was amazing. That was amazing. You had to transit from emergency medicine to primary care to like you said about the front lines. Amazing. Thank you so much, Dr. Sina, for talking us through about that transition and how it's affected your approach to patient care in general. All right. So the next question is as an NHS clinical entrepreneur, what innovative projects or initiatives have you developed, and what impact have they had on patients' outcome or healthcare delivery?
So I applied to the NHS Clinical Entrepreneur Program with an idea for a digital mental health tool, primarily for people that look like me. So for Black women, Black men, but also just generally minority ethnic groups where there's a lot of stigma and discrimination and miseducation around mental health. Um, it was a project I'd started on social media, which then evolved, and I was thinking to take it further. So that was what I applied to the program to. It's a project that's since evolved. Because I was in training, the sort of time and attention I could give to it was very limited. So it's only now that I've finished my training recently that it's something I'm hoping to get back to through a different lens. But I've been able to take what the program taught me and apply it on a more grassroots level. I designed a ADHD toolkit because we were having lots of patients presenting at our GP practice with ADHD. And these patients weren't aware of the resources that they could access. There were long waiting times for to be seen and assessed for ADHD and autism. And so this toolkit was something to give patients, but also for clinicians to also have readily available to signpost patients, but also to understand what was available to support them. So that was one thing. Another thing was creating an emergency care toolkit as well. During my time working in psychiatry, where staff were not as used to dealing with emergencies. So some of these are kind of examples of ways I've been able to use my background in science communication and as an A&E doctor formerly to try and create solutions that address real issues.
Mm,
So yeah.
amazing, amazing. Another question that popped up right now is, why did you apply for the NHS Clinical Entrepreneur Program? What drew you to that program?
First of all, there's no program like it out there at the time. So number one, it was unique. I was also really, and I'm still interested really in the ways that health and technology can combine, the ways that we can innovate and improve public healthcare systems like the NHS. But also, I'm very much a champion of the fact that change needs to come from those who know the system best. So you need innovations that are driven by doctors, nurses, physiotherapists, radiographers, radiologists. You need people who speak the language, who know what the real grassroots problems are, and can therefore design solutions to them. So that drew me to this. The program is also really unique because it offers training in different things that are relevant to building a company. So, for example, financing and accounting, how to pitch to investors, marketing practices. These are all things that drew me to it because it had that element where I'd be learning. I'm not just there to, you know, bring a project and get on with it. It's like, no, we're going to teach you and develop you. It's a workforce development program. So these things drew me to it and I decided to apply.
Amazing. I'm really amazed that that program is like a pavement for improvement. It teaches you more. Like I tell people that medical doctors, medical students, they have other interests as well. Like sometimes, studying medicine can make you overwhelmed that you don't even consider other interests. But such
Yeah.
programs like this can open, doors for you to see other interests that could, make you be interested in it. So thank you so much, Dr. Sina, for that one. That was an amazing answer to that question. So the next question for you is amazing. How do your passion for act, and writing, intersect with your medical practice? And in what ways do you think that creativity contributes to effective healthcare?
Good question. I'll answer the second part first. How does creativity contribute to effective healthcare? Humans are continuously evolving. Human problems, so diseases, evolve. And these changes happen rapidly over time. The ways that we eat, the ways that we sleep, the stresses we're exposed to are vastly different to the same things that our grandparents, great grandparents, etc., were exposed to. And so, really, there are new challenges now in healthcare which require new ways of thinking. And in order to think in new ways, you need to be creative. You need to have a different way of tackling these problems. And so being creative in healthcare is now an asset, even more so than when, say, I was a medical student, what, 8, 10 years ago. Being that ability to think outside the box is what's going to drive the healthcare of the future. And so when we think about things like AI, for example, which is a very topical thing, AI is thinking outside the box, right? People are using AI to design new solutions to everything from health communications to, even as a GP for myself, there's now AI tools that can be used to write consultation notes so that you're able to focus on the consultation and then you have this scribe writing things. No one would have thought of that unless they thought outside the box or unless they thought of a new way to solve an existing problem. So creativity is really, really important. So that's the answer to the second part. And what was the first part, if you wouldn't mind repeating it?
Your passion for acting, writing, and how it intersects with your medical practice in general.
Another good question. How does it intersect with my practice? Medicine has taught me a lot about humanity. It's a life path where you're constantly learning, and you have to be creative, but also you have to adapt very quickly. And I found that a lot of the skills I have as an artist, I've had to use within my practice. So being good with people, for example, knowing how to pick up on cues, using non-verbal communication, so my body language or how I express myself. You know, as an artist, how you express yourself is very important. With patients, the way that you express yourself is also very important. So those are just a few examples of where it really ties in as well. And it's really what makes me a different clinician to say if I didn't have any sort of artistic gifting.
Mm, mm. Amazing, amazing. I think that your passion for writing and art is really working in hand to make you, your medical practice an amazing one for you because like you mentioned about your body language. There are patients that like I was speaking with a primary care medical doctor on my YouTube will be dropped very soon, and she mentioned about a disabled patients that can really open up to medical doctors because they feel they're not worthy, they're not acceptable to the society at large. The patient was like because they want to do some tests on the patient, so
Mm.
the doctor asked the patient to her name is Dr. Hannah. Yeah, so you can actually expect the video. She asked the patient to do you want me to remove your clothes for you for the test? The patient was like so ashamed, open to remove her clothes for some tests or something. The doctor, Dr. Hannah, kept, persuading her to do that. She was still shy, or let's say she was ashamed, and she was disabled as well. So Dr. Hannah came up to her and told her that I was in your shoe a few years ago because she was disabled when she flew from Ghana to the UK to continue her master's, to do her master's in public health. And she had a terrible incident that made her to be disabled for some time. So she told her that when she was disabled, people do things for her. She barely do things for herself, like to push her out of a wheelchair and let her to do a lot of things. So
Mm.
perhaps she doesn't even care if it's a man or a woman doing that to her. So and after explaining that thing to the patient opened up. She was like, "I'm ready to do the test."
Yeah.
You know, after the test, Dr. Hannah took her to her husband. Wait in the waiting room. After the test, and she was like crying. I was like, help me thank Dr. Hannah. She's incredible."
Oh.
So the reason I share this story is the body language. Making patient to understand you as a medical doctor, as a medical personnel in any country you are in. So just be open to your patients, make them to be comfortable, talking with you. So Dr.
Mm.
Sana, thank you so much for talking to us about that. So the next question for you is, Can you share your strategies for effectively communicating complex medical concepts to different audiences? And why do you think this is important in today's healthcare landscape? What do you think?
Why is it important? I'll start with that. It's important because in our modern day healthcare setting, you have more diverse people. You have an older population in most parts of the world, especially here. Um, and the ability to relate to people is even more of an asset now than ever before. The relationship that people have with doctors, with physicians, nurses, etc., now is not as much of a dictatorship as it was before. People now Google stuff. My advice as a medical professional is do not Google stuff. Go on the NHS website if you're based in the UK. But that said, people go to Google, people go to TikTok, people go to other forms of social media for their health information. What COVID did is it made people more health conscious and more alarmed, I guess, about their health. It really instilled fear into people about their health and the consequences of poor health. And so, in response to that, we need to be practitioners that are able to understand where that fear comes from and what's driving it, but point people in the right direction to where they can get the right information from. Now, because people are so health conscious, it also means we have to take into account that people are from different cultures. The UK, London in particular, is very diverse. And so the way that you would communicate to one patient, you would have to adapt to another because, number one, they may speak a different language. Number two, they will probably have a different context to the patient you saw last or two cases ago. London is a melting pot of not just different cultures, but different social status, so many differences. It's what makes us unique. And so the healthcare professional that can adapt quickly and can communicate with different people is truly the healthcare professional that gets things done, in my opinion. Effective strategies. Number one, I love a pen and paper. I'm very visual. So it's a language, you don't have to both speak English, for example. A diagram says a lot. So sometimes when I'm trying to explain something to someone, I draw a diagram and I point to it and I use gestures. Of course, we have interpreter services where necessary, but even with patients that speak the same languages as I do, a diagram is a good way for them to understand. And when patients understand what's happening, they are empowered and yet they're more reassured as well. So that's one strategy. The second is pointing people to the right resources. So I mentioned the NHS website, YouTube Health is another great one, which you may or your audience may have heard of as well. Government websites as well are really good. These are all methods of communicating with patients. And number three, I would say also recognizing that the people that we have in front of us as patients are human. I think sometimes it can become a bit difficult to remember that because we are under pressure to see X number of people in X number of time, whether you're in hospital or in a GP setting. And sometimes we can dehumanize the people in front of us. So it's no longer, oh, I'm seeing Mr. Ransom. No, it's okay, I'm seeing appendicitis now, or I'm seeing, oh, next I've got asthma to see, or next, do you know what I mean? We label people by the problem we're trying to fix because we get into problem solving mode. So it's stepping back. Communication is enhanced 10 times more. That's not a statistic, that's just my theory. It's 10 times better when we step back as practitioners to recognize that I have a human being in front of me, but also that I am also a human being. And so I need to be mindful that the way I communicate may be influenced by, am I hungry? Am I tired? Was my last patient difficult? Am I in pain? And it's what we call in our training housekeeping, recognizing what may impair your own ability to communicate properly with your patients and doing what's necessary to prevent it from affecting the consultation. I hope that makes sense. That's
Amazing.
the thing that's important to recognize.
Wow. Amazing. That drawing aspect you mentioned about the patient is applicable to patients that are kind of like deaf or dumb. It does apply to that kind of patient, right?
Any patients, not just those with a disability. You can have highly uh, educated, well versed patients, even fellow health professionals, who might struggle to understand. For example, if I go and see my dentist, I'm not a dentist. They may explain something and I could just look at them like, huh? I'm a health professional as well, but they have a different language and way of communicating things. They have a different understanding. And so they need to adapt how they explain things, show me pictures, draw a diagram of my teeth, all that, in order for me to understand. And so
Mm,
we have to recognize that it's sometimes the issue comes when we talk down to people or when we assume that we are here and people are here, our patients are here, right? We need to level the playing field because we won't always be the ones that know everything. Sometimes the patient is the expert, right? Sometimes if I go to the mechanic, which I don't enjoy doing, I'm not a mechanic. So I can feel really dumb at the mechanic, even though I've got XYZ degree, right? Because they will speak in their language and I won't know what they're talking about, engine oil, whatever. In that setting, I don't know, I don't have a clue. I might need a diagram, right?
mhm.
In a different
Yeah.
setting, and I become an expert on whatever it is. So it's when we understand these nuances, we learn, we appreciate our differences, and we have hold more respect for each other, and we're able to communicate better, in my opinion.
Amazing. Thank you so much, Dr. Sina, for that one. And one of the courses I did in my second year, um, psychology and radiography and nursing practice and radiography as well. The man, my professor, I don't want to call his name, but he taught us that the patient is the king in the hospital setting. The reason why doctors, the reason why nurses, the reason why all kinds of medical, personnel are in a hospital setting is because of
Hmm.
the patient. If there is no patient, there'll be no doctors as well.
Hmm.
So there's no point of talking down on people. For me, I'm a radiography student. Whenever like I told you, like I do my clinical rotations in a federal hospital, and
Okay.
I have time sometimes to move into other specialties. Like people studying orthotics and prosthetics. You
Yeah.
know, doing artificial kind of body materials or something that helps in also orthopedic kind of like surgery and stuff like that. So yeah, whenever I go in there, I feel lost. Like, how you guys doing this kind of thing? Like,
Yeah.
how do you create an ear? Like, I saw an ear that artificial ear, but it just seems like it's a natural ear. They had to just fix it,
Oh,
hands and the metacappas and all those things. I was like, what's going on? How you guys doing those things? You
yeah.
know?
Yeah.
Yeah. So you don't have to look down on people. Just take it like that. Just be yourself, do your thing. Don't ever say I'm bigger than you. Like surgeons are like biggest. No, everybody's is needed in the healthcare system. So yeah, before I proceed, Dr. Sina, how do you work with patients that have different religious faith? How do you do that?
By how do I deal with that? How, what do you mean? Do you mean, does it affect my
Yeah,
practice? Or
yeah. How do you do that in practice? How do you encounter all those kind of patients? How do you work with them? Because some patients have different motives, different, belief system. How do you try to intersect your own belief system with theirs, to be in one page?
well, I look at the person in front of me and I recognize that um, there will be differences in what we might believe or our outlook on life, faith aside. culture, upbringing, uh, education, gender. There's so many reasons for us to differ on viewpoints. But in the 10, 15 minutes that they're in front of me, I have a duty of care towards them. And my role as their doctor is to try and solve what I can, is to try and help them. Now, there is no border that eliminates that responsibility that I have towards them. There is nothing which, I wouldn't say I'm not prescribing for that patient because they think differently to me. No, as long as there is mutual respect, or even when there isn't, as long as, the patient isn't, I'm not in danger, right? Because you can get people who are very agitated, aggressive, rude, angry, racist, sexist, whatever, right? But as
Yeah.
long as that's not happening, it's difference has never been and should never be the reason to treat people poorly. I know that in the world, this is always the excuse for people being treated poorly.
Mhm.
Medicine is
Yeah.
different because you may have a different political belief, a different faith system, but if we both are cut, we're both going to bleed. We're both going to have color blood.
Yeah.
Um,
Absolutely.
and that's just what it is. This is how God has made us. We have a lot more in common than people think. So
Amazing.
this is the view that I have. And
Mm.
my upbringing was, I've been fortunate to have been brought up in different cultures, different settings. I'm used to being with people who, or around people who don't look like me or think like me or act like me. And I acknowledge that that's a privilege that I'm able to have, because people who say have been raised here in the UK all their lives, or don't have different cultural backgrounds, may not have that same ability. So, yeah.
Absolutely. Absolutely. Because the reason why I asked that question, I don't mind. Maybe she can watch this video. So I don't want to share that story right now because I didn't take permission for sharing that story. So that really prompted me to asking that question. She made mention about that mutual respect, and there are patients that are really, you know, rude, like you said, and always agitated with things, always curious. If you mention about something you're not familiar with, they'll be like, "Would you mean? Could you tell me what do you mean?" It's crazy. Like I don't want to share that story.
Okay.
She's a medical doctor in general surgery in the U.S. So
I see.
she then mentioned about how she worked with people that are racist. She's a black medical doctor, you know, from Africa down to the U.S.
Hmm.
You know,
Hmm.
yeah, she said a lot about her encounters with people that think differently from what she or believe differently than what she believes
Yeah.
or something. That
Yeah.
really prompted me to ask you that question. But it's amazing that you say that mutual respect must be there, and I'm just here to do my thing, regardless that we are not in the same page. But my own, I'm doing my thing, and you're corresponding to what I do, and we are not. There's no dangers between us. So that's amazing, Dr. Sina. Thank you so much for sharing that.
No,
So the
no
last
problem.
question here,
Yeah.
I want to
No.
say something.
I was going to say that that remains my way of doing things. That said, that we have to be honest and acknowledge that there are inherent biases in medicine, in Western
Mhm.
medicine in particular. Racism is something that majority of Black doctors have experienced in this country, Black women, as in particular. Um, so it's not for. I think it's important to have both conversations. To say, how do we treat, not just how do we treat people well, but how do we treat people well despite knowing we're different? We don't want to pretend people aren't different, right? We don't want to be covering our
Yeah.
eyes or our ears and being like, oh, it's fine, we're all the same. No,
Yeah.
we're not the same. But it's holding that respect and not letting the negative experiences we've had in a broken system dictate how well we treat people in front of us.
Yeah, absolutely. And she also made mention about culture shock. Because
Yeah.
she made mention. if she's trained in Ghana and she came to Nigeria to practice as a medical doctor, she's an international medical doctor. And
Hmm.
Ghana's natural belief system is quite different from, you know, Nigeria's own. So she flew in from Africa, took the USMLE step one and all that. She made it through. She came to the US and she
Mm.
faced a lot of cultural shock that really affected her medical practice as well as a
Yes,
general surgery,
yes,
medical
yeah,
doctor as well. So yeah, it's amazing that we face a lot of things, like you said, that there are a lot of biodiversities in
mm,
medicine,
hmm,
but it just left to you to, on how you correspond to such situations, because we face a lot, we health professionals as well. Because I don't want to talk about Nigerians only, because the way we treat people here is quite different the way they treat in the UK. Like it's so different. So it's just how you adjust to that situation is what matters the most. So thank you
mm,
so much, Dr. C. The last question for you is, all right, so there are medical students, there are going to be medical students out there. They're going to watch this video, young doctors as well, because
hmm.
I have a lot of doctors watching my video. Thank you all for watching. And also medical students as well are going to watch this video. So tell us, what advice would you give to medical students or young doctors out there going to watch this video, interested in exploring not traditional roles in healthcare, such as entrepreneurship and science communication. So, what advice do you have for them?
Go for it. 3 words. Go for it. Um, the things that you are interested in are unique to you, and you won't always have a blueprint because you might be the first one doing the thing. And I would say, do not let that discourage you. You are unique. Your view is unique. Your gifts are unique. And you do society and the world a disservice if you shrink those gifts and hide those views because you're trying to fit into a traditional conventional box. So be excellent in everything, even if the things seem like they're worlds apart. So you may be, I don't know, a singer, but you're also a, I don't know, radiologist or radiographer, right? Be excellent in both things and understand that there will be different seasons. There'll be a season where maybe you have to be a radiographer first. You need to do the training to become excellent, get the experience, all that. It might not be fun, but there might be a season where that needs to be your focus. But there'll also be a season perhaps where you can balance both, or you might be able to be a singer first because you've already set the foundations in the other interest, which will fund the thing that you actually enjoy doing. So, yeah, in a nutshell, go for it. You are unique, and there's a season for everything. So trust the process. That's it.
Absolutely, absolutely. The process is always rigorous, but you have to really trust this. Yeah, really trust the process. You can combine things together with your practice in medicine or with your
Mm,
training as a medical student. Because I have a lot of medical students as friends. YouTubers, they create content, they work with brands and all those things. So and they're still doing well in the medical school they're in. So just know that you're unique, like Dr. San said. So you have to, follow these nuggets because these are amazing nuggets because I wrote them down. So thank you so much, Dr. Sina. It's an amazing opportunity for you to, because you're very busy. Medical doctors in the UK are very very busy people. So like she has time to do all this for us. So you have to, if you're an audience, you have to pay attention to what she says out there. So if you're looking forward to connect with Dr. Sina, her details will be on the YouTube description below, so make sure to connect with her. If you have questions about, entrepreneurship, science how you want to be the writer in science communication, just reach out to her. You can drop the questions on the comment section. She's gonna answer your questions as well. So thank you so much, Dr. Sina. It was a pleasure to have you aboard. Thank you so much.
My pleasure. My pleasure. Thank you.